Let's go ahead and call the meeting to order. Roll call.
Dale Schleter,
Not here.
Marshall Savitsky.
Here.
Jesse Betcher.
Here.
Michael Maestri.
Here.
Chris Rust.
Here.
Lorraine Gouget. John Pettit.
Here.
Carol Pearson.
Here.
Sabrina Dunlap. I think she's online.
She's online.
Please stand for the pledge of allegiance.
Allegiance to the flag of the United States of America.
To the republic for which it stands,
One nation, under God,
God, indivisible, liberty and justice for all.
You. Okay, certification of compliance with open meeting laws.
This meeting has been noticed to the public and news media as required by section 19.84 of Wisconsin statute.
Thank you. Meeting agenda. Anybody have any questions or changes? Okay, we'll move on. Public comments. Do we have public here? I'm sorry, somebody said something.
No hands up online.
Okay. Moving on. Committee reports.
Minutes.
Always miss them.
I'll make a motion to approve the minutes from August. I'll second that.
Thank you both. Any questions? Everybody in favor, please say aye.
Aye.
Anybody opposed, same sign. Motion passed. Now we'll do the committee reports. Maureen?
Yeah, sorry, it's gone so long. I have so many meetings I have to attend now at the state and national level, so
Oh,
just wondering if you know that I would have been. But I did want to get an update of what we had from our clinic come to the pandemic. I like to keep those updates going because we're not in this pandemic yet, and we're still trying to live healthiest way we can, prevent those people with losing before losing one. So last week the Elkville Clinic had 4 positive COVID-19 cases. So far this week, we have another 4 positive cases. These numbers may not be an accurate depiction of the rate of infection in the Elkville community. There are a number of community members self-testing at home and not reporting these numbers. The infection for COVID-19 variant at this time are more prevalent in younger ages, but symptoms are less severe. We are not seeing a lot of hospital stays or patients placed on ventilators. That's good. The Elkville Clinic has bivalent Omicron booster available for both Pfizer, ages 12 and up, and Moderna, ages 18 and up. Clinic staff are in the process of setting up delivery of these vaccine boosters. As of today, our yearly flu shots have not yet arrived. In previous years, we encouraged patients to wait and take flu shots to extend coverage throughout the late flu season, but due to an infection of a serious influenza outbreak this winter, we are encouraging patients to get the flu shot as soon as available. As soon as the clinic has flu shots available, we will be contacting patients to get them scheduled. We will be setting up times for tribal entities to have clinic staff give these vaccines on site with ED. Directors will be advised to contact Dr. Steve. Smith, Medical Director, Christine Clarkquist, Nursing Director, for pretty long time, Community Health Director for rabies vaccines. So we are going to keep doing everything we can to keep saving lives and keep addressing what we're seeing this pandemic. So, but anyways, I wanted to update some of the things that we've been working on. I know we have just purchased Norwood Haven, and we are pursuing making that into a sober living facility. For those who are homeless, you need the support, and those who are working on recovery. So we're going to be trying to reach more of that population in that setting, and which would be short term, but yet meet the need that we see and then help them get going again so we keep that evolving support they need. We also are bringing ground for a new elder center in the spring. That has been prolonged, it's breaking ground in the spring to build a new elder facility. We are going to be building a 40-unit apartment building for our workforce. The goals need that support there so that we can provide that need with 40 units with 1, 2, 3 bedroom apartments. I'm not sure when groundbreaking is for that exactly just yet. In our new clinic, we are pursuing and if things come together, we're hoping to break ground yet this year. So we'll see. We're working on some major things. Our facilities are still open at the men's shelter and at the emergency shelter for women and families that need that support. And we're trying to pull in our services as much as we can to help them with the issues that we're dealing with. And Diane Sullivan now is going back home to help us with our AODA programming, GQ Wellness Center. She's one of our people now, those of you who know her and those who know her very well, to help us address what we're seeing with AODA issues and the epidemic of opioid crisis. We are trying to build more programming as much as we can, working with what we have, and we still continue to provide the treatment care that our people need while we're still looking for something to have closer to home. So we're still looking at it. I know that our ICW department, with their services, we're trying to find ways of how we can work with more of our families within the home to keep those children intact with families, and then the kinship part, keep them connected to that help and support, so that our children are not going to be placed out of the home or the community, and keep them closer to the tribe and to the family members. So there's different things that we're trying to address and naturally even how they work family when it comes to the programming that comes down to the different departments. Families are identified. With Native people, we have a lot of extended families who take care of multi-generational. And then how some other people play an important role in their lives. It could be a namesake, someone who stands up for them and they get their name. And certain ways that we have our families step in that don't meet the definition of the way it's worded with the funding sources and programs that come down to us. So we're trying to address things with her. And then the elderly center is doing well. They're all fully staffed and they're operating. They are able to get those meals out to the elders and continue to try to address all the needs that they have, and then try to bring more of them in now that we're getting a little bit safer with this pandemic, where they can be now, where they can socialize more with their peers and be in a safe setting and engage them in those areas that they need supported, in dementia to other illnesses that they may be experiencing. Or it depends on what you're at, but the support that's needed. But it's all I can share at this time. I just been gone so much. I just didn't do that thing, but I wanted to update you on some of that we've been working on and that we'll continue to work on. Oh, one thing I want to mention too, for kids. We're now university, our college campus, the university. So we are offering more programming for our people in our community. And we are up to that level now. And so we encourage our people to continue with their education. Indian, non-Indian, whoever needs to have that education and peace there in our community. To have what we have to offer them so that they can continue on. And I know, like, even with trainings and things, we have city health classes that we're offering our tribal members at the time. And we see that shortage of drivers across the board. And whether it be construction or bus drivers or transit, you know, at any, you see it all over. So we're trying to train more people. And, we build one class, we're gonna do the second one as soon as we can, so. We're trying to address that, because it affects all the programs that we do, and then people need that support. But anyway, there's some of the things that we've been doing.
Thank you. That's quite a lot. Any questions? Any questions? Okay. Senior Resource Center. There's nothing to report, no changes in the budget. No. You go ahead.
Yeah, I don't have anything for the report. I guess I just wanted to, when I'm getting into budget time here, we're putting together. And one item that's probably gonna come up for discussion, short-term and long-term, is regarding the senior resource request. So they've requested $226,000 is their support for 2023, which is a increase from 105,000 this year. It's been steadily going up from low 90s to 101 to 105 and 226. And primarily their increase in costs is regards to the meal program, the congregate and home delivered meals. Price has gone up significantly to in the $14.45 range for home delivered meals. So the cost of food, cost of packaging, cost of overhead is all increasing, which is resulting in the increase in the request to the county for support for that program. So I just bringing that out now, so it's not a shock when we get into the budget. We did talk to them when we met with them about some alternatives. Obviously there's not, there's some things that would be more long-term looking to try to bring that cost within more under control. But some of those types of changes would be difficult to do on the fly. So just wanted to highlight that now. The senior resource, they're a contractor of the county. They provide our aging services under a contract through Human Services, and we provide some of the grant funding comes to us to go to them for Alzheimer's and what's the position?
Oh, they do the elderly benefits specialist. So we contract with a contractor. They have that position within Health and Human Services. They provide the meal services and transportation.
Meal services is probably the largest cost of what they do.
It's 120% increase in meals.
Yes.
That's in the cost of the meals. Is that right? Is that what you're referring to?
And the number of meals is.
And the number, oh yeah, both have gone up, both cost per meal and number of people.
Does that charge includes delivery?
Yeah, that's the
The whole thing.
yeah. I think they were prior years closer to $10.49 average cost. And it's going up to now 14.
How much more applies?
They're projecting 33,450 meals. Don't have the meal numbers what they were doing before.
I'm sorry, what was the question?
How many? What's the increase in meals or the increase in people being served?
Okay.
I don't have the fire.
Okay. All administration.
Administration, once more, we just have that standing resource document for you regarding the Health and Human Services services for your reference. And they'll ask me to be real explicit about when I'm done with one of the reports. That concludes administration. We're gonna move on to adult long-term care. We have a new adult long-term care supervisor. Her name is Sarah Sobecki. She holds a Bachelor of Arts degree in Rural Human Services from Finlandia University in Hancock, Michigan. She has worked for a number of years at the Human Development Center in Duluth, Minnesota, and held multiple leadership positions. And most recently, she was a care coordinator for St. Luke's up in Duluth as well. Also want to draw your attention, I've talked to Mr. Alvarado about this. We have a dangling half-time information and assistance specialist position open. And so does Iron County. We're having a difficult time filling those positions. So we had a preliminary conversation, introductory conversation regarding a potential shared position between both counties so it could be full-time. So what we met for about an hour, not last week, but the previous week, about looking at what that cost may be. So we sent Sawyer County's cost for that position and Iron County's going to submit theirs. Then we're going to have a discussion about who we might propose that position be placed as. It has to be either in Iron County or Sawyer County. And then it's going to be the logistics. How is that going to work? So it'll be multiple conversations talking with our staff and their staff, how this might work. We're trying to come up with a creative solution.
What was the title of that position again?
Information and assistance specialist. That concludes the adult long-term care report. Behavioral health. Alicia Carlson submitted a written report as per usual, and I want to highlight a couple of things on there. One is she mentioned all the counties continue to struggle with recruiting and retaining CCS staff, less so at Taylor County because they have a whole dedicated unit to that. And then we had a lengthy discussion about how we're recruiting therapists, and we're trying to be creative, but haven't really come up with a viable solution. And in addition to that, the person in Taylor County who oversees the CCS program, Shell Kettlehut, is going to retire at the end of the year. So the challenges continue.
It's good, you know,
Also related to, it's not an Alicia's report, but Joe Bodo and I met Mr. Alvarado last week regarding some behavioral health crisis response concerns and behavioral health transport concerns. And we would like Joe to spend a couple of minutes talking about what those are. So.
Okay, and in addition to the behavioral health report, I wanted to share one other thing that because time is of the essence. We operate the OWI clinic here and do drug driving assessments by according to the state regulatory system, and it's based on, many of you remember the 5142 board. Some of you don't remember that. You certainly remember it. The 5142 board designates the public facility to do the OWI assessment. I'm only sharing this right now. I have the language right here, but the new law goes into effect October 1st for this licensure. And we just received the application from the state. And in the application, we have to have county board approval to designate the county entity as the assessment facility. It reads, in accordance with DHS 6205, no agency may conduct intoxicated driver assessments and develop driver safety plans unless appointed by the board as a designated intoxicated driver assessment facility under DHS 6204. County board under 51.45 statute ultimately has the authority to designate the assessment facility, and if the assessment facility is publicly approved facility. I will be asking that I get this language to whomever can have it to go to the county board so it comes up on the agenda and somebody designate this county as the entity, and then we have this for the license that goes into effect October 1st. It's just kind of something that has to happen. I don't know about the particulars here, but we just got the information. Is that possible?
No, I'll take it.
Okay, good. All right, thank you. Thank you very much. Getting back to what I wanted to bring up again. In lieu of the fact that I'm not going to be here forever, it's not going to happen. And this on-call thing is out of control. The problem is more and more providers, more and more entities are bringing all these programs, but they're not doing anything to help out with this crisis. And we looked as Paul had said, and Andy says, we'll look at Russ County. Well, and I said, Russ County is a great county, but it's not Sawyer County. They don't have these same problems and they don't have a reservation. The director of that program used to have my job. He's been there 27 years. He's never done a 3-party petition to commit somebody. I did 30 of them in the first 2 years I was here. People come and say, we need to commit my family member. Imagine that, 27 years in a county and never committing something. I'm not saying a bad thing. I'm saying it's a different kind of accounting system. What that equates to me is that we can't solve our problems here using what goes on in other counties. We have to formulate our own things. LCO was phenomenal a few years ago with their behavioral health. They got up to speed. They have little cards for the LCO deputies, LCO crisis warm line, if there was a problem. That went by the wayside. Now I'm dealing with crisis at LCO. I'm dealing with an elder, 50-some years old, who lost a spouse, lives on a kicking dog. If I'm pronouncing it wrong, I'm sorry, but that's not too far from Beziki, I would think. And he has no idea that there's counselors there that can do grief counseling. We can't solve these crisis problems unless we work together. That entity there needs, when they give people coupons or benefits or whatever they do, there should be printed on the back that you need help, this is what we do. We need that warm line back. They told me they can't do it because they hired people that lived out of the area where they had phone calls. These other entities that establish shop here, and they keep establishing shop, if they don't help solve this crisis thing, we can't do it with our staff here. You know for a fact, Marshall, who do they call? Not Ghostbusters, who do they call? You. And what am I telling you? I'm telling you it's getting to be too much, and these folks are not gonna wanna do it here. They're gonna resign from these positions. In Russ County, they have child welfare people doing it. They have a multitude of staff that's doing it. They're using some of their adult service workers. You know, that's not the climate that's been here. You know, that you're going to get these people to call out in the middle of the night and come out and see these people on top of their other duties. Maybe it can work. I don't think it is going to work, but we're open to discussing it, but it's critical. The first solution is going to be manage the crisis. I dealt with a crisis last night. I'm dealing with more crisis with people that are at the hospital, drug-induced, methamphetamine, everything else. They're all on probation. You know, I call it probation. You know, they're on probation for what? On probation for doing drugs. They don't keep their appointments. You know, it all falls to crisis. We cannot handle it here. I'm telling you. You know, I'm not going to move out of this county. I'm going to be here. I'm going to tell you, we can't handle it. It's out of control. But we need these other entities to work towards me. I called Diane Sullivan because Lorraine is right. I know Diane. Excellent relationship, great hire. I've had a phenomenal career working with Diane. And I said, you got to help pick up the pieces for some of these folks that when they're being seen at Beziki. I had a 14-year-old girl the other day seen at Beziki, had a crisis later on that week, a couple of days later. Yeah, we need some help with this. We should partner like we did with the transit. We should partner like we did with the drug court, with the tribe, and try to resolve this crisis. I speak in my mind now because, you know, that's the way I feel. The other thing I was going to say with these transport costs, the sheriff's department's got nobody to do transports. They're calling an entity from La Crosse, Wisconsin, to drive over here to pick up people, to transport them to facilities. To send somebody to go to Sacred Heart is costing us almost $800 when using a deputy was only costing us a little over maybe 300 tops. How can we incur these costs? I don't know. It's a problem. You know, and I understand the sheriff doesn't have enough personnel, people to call in, correct? Is that what's going on? If there's nobody to transport, maybe we need to think about developing a transport crew, hiring some older guys. Why fuel a cottage industry, whether it's in Green Bay or in La Crosse, where all these retired coppers are working, and why should we pay them to be moving people? Maybe somebody here should look at how do we develop that locally. Maybe we could start that and farm it out in some of the other places instead of bringing these people all the way over. I don't know. It's just things to think about. I need some help trying to develop these ideas, but I just wanted to share that. And Andy, I'll get you a copy of this so you can get that. Yeah, we'll get it. I said I'll get it now. But any questions? That's it. Okay. Thank you.
I agree.
Right. Thank you.
I have a question.
Yeah.
Don't we have any retired officers or deputies or people that were in law enforcement previously that maybe would do some of these transports? Or is there a special licensure they have to go through to do it, or no?
We'd be better off contracting out with somebody else. If we're gonna pay $800 to go to Eau Claire from here.
Yeah.
Okay, so what about one of these agencies? Maybe you should hire a guy and we'll hire a minor deputy. Or maybe LTO can hire a few part-timers and charge us and we'll pay them. It's
There's
just,
gotta be a.
there's gotta be a solution. That's all.
Thank you.
All right, also under behavioral health, you have your mental health cost by client report for your review. This concludes the behavioral health report.
I have a question, Andy, are we gonna go and get that on the county board agenda without being voted on here in committee?
I was gonna take a look at it and see if we can get it to the admin committee, just as a backstop, otherwise I can take the route of having. I need to see if it needs to be a resolution form or what form it needs to come in. Putting a resolution together that a couple of you could sign off on and then get the board to have a 2/3 vote to bring it on the floor.
Right, because there's nothing we can vote on here in this committee tonight.
Really not in format that's presentable to you.
Okay. Thanks.
But if it comes through a committee, it still has to have that 2/3 vote.
No, if it comes to a committee, it does not.
Okay, so admin would be,
By
Tomorrow morning, then.
10 o'clock in the morning
Yep.
tomorrow, or 24 hours notice.
Thank you.
Okay, next we have Child Protective Services, and you have the usual reports, the CPS report and the substitute care report. If there aren't any questions or comments, that concludes the Child Protective Services report. Youth Justice. You have the Youth Justice report as per usual. If there aren't any questions or comments, that concludes the Youth Justice report. Next is the Economic Support, and Shauna White, our Economic Support Supervisor. This is her evening to give you an overview of the Economic Support Unit. And she has a PowerPoint presentation to share with you.
So first, I'll just kind of go over what economic support is. So it's public assistance for food assistance, medical care, child care, and caretaker assistance for SSI recipients. And Badger Care Plus is a health care coverage for low-income Wisconsin residents. So that's children under age 19, adults 19 to 64 who are not receiving Medicare. Pregnant women and children, their federal poverty level guideline is 306%. So to give you an idea of what that would be for gross income per month is $3,465.45. So it, is a program that would help many households because of that higher income limit. Parents and childless adults, they fit under that 100% federal poverty level. So the gross income guideline for that program is $1,132.50 per month. So it's a very low income guideline on that program. For the state of Wisconsin, Badger Care Plus insures about 50% of all children. So it really does take care of Wisconsin's children. For Badger Care Plus, there is no asset test. It's just an income-based program. Medicaid 65 and older for elderly, blind, or disabled. Their income guideline for the full coverage Medicaid program is $1,132.50 a month. That program does have an asset limit. So for a single household, that would be a $2,000 asset limit. So that's liquid assets that are in a checking or savings. and $3,000 for a 2-member household. We have the MAP program. The MAP program is for those who are disabled and are able to work or do some sort of in-kind employment. That has a higher income limit, $2,831.25. And it also has a higher asset limit. The asset limit for that program is $15,000. So we're able to really help a lot of those people that before their Medicare comes through. So they're determined disabled, but they're waiting on Medicare. So it really helps that percent of the population. The Medicare premium assistance payment. So when you go on Medicare, you have a premium, and the state does offer a Medicaid program to help with those costs. And so there's 3 different tiers to that program, but basically if your income is less than $1,528.88, you would be eligible financially for that program. And then that asset limit is $8,400 for a single household and $12,600 for a 2-person household. So that's kind of Medicaid, just a brief overview for those of you who don't know much about healthcare. Food share or food stamps or EBT, different names that you hear. That program is a low-income household program. You know, it's designed to get nutrition, good food for households. It can only be spent on groceries, can't be spent on any cosmetics. It's food only. 200% of the federal poverty level. So the gross income for that program for a single person is $2,148. And then there's also a net income test, and the net income is $1,396. And then just to kind of touch on Wisconsin Energy Assistance, we're getting ready to start that program. It starts October 1st. We are anxiously awaiting right now the guidelines. They have not published the financial guidelines yet for that program. I did have a meeting last week that talked a little bit about what the benefit was going to look like this year. Not great news for us. The average benefit last year for heat, so natural gas propane, was $417, and they're projecting $310. So that's the benefit amount that homes would receive for the heating season, the entire season. So the electric benefit stayed about the same. It was $195 last year, and it's $210 this year. So under the pandemic, we had a pretty unlimited pot of money to help people meet their energy burden. And this is one of those programs that is rolling back to pre-COVID. So there are limits in the crisis payments that we can administer. And the limit for the heating season is $1,200. You know that the price of propane right now is right around $2 a gallon. I'm suspecting that we're going to have a really tough time helping people. We are already telling people, you know, make whatever kind of payment you can. You know, if it's $25 a paycheck, like whatever you can, be paying on it, because that's the other component that they're looking at having us do, is to get the consumer to also match. So big changes in that program. The PowerPoint, let's go to, I'm just kind of get, you have this for your pleasure to read. But I'm just going to kind of go over and give you the highlights. So every year we have a management evaluation review for our consortium. We're part of a 12-county consortium. And ours was the best that we've ever had. We normally have a pretty good review, but this one was, just gonna say it, we're the best in the state.
Good for you.
They said over and over, you make our job easy. You know, all of the remarks were very good. Slides 8 through 12 and 19 through 21 are survey results. And so basically, you know, it illustrates that workers are doing an excellent job explaining the programs to customers. Customers are aware how they can complete interviews, because we're able to complete interviews in person, over the phone on demand, by online application through Access, mail-in applications, lots of different ways to apply for the programs. Customers felt that they were treated fairly. And then overwhelmingly, you know, positive comments, a 10-to-1 ratio. Then looking at slide 23. So that is our recertification process and program access review results. And just want to zero in on, there were no errors found. So that's when they pull our cases and review them, and they didn't find any errors. Slide 24. So I'm the economic support supervisor for Sawyer County. For the Northern Income Maintenance Consortium, I am the supervisor for fair hearings and appeals, and I also am the fraud supervisor. So I oversee all of our fraud and overpayment claims. So I'm, of course, very proud of this finding. Did not know that they were going to review overpayments this year. You know, it illustrates that we have a commitment to program integrity, and we have the highest claims in the entire state. So that's myself and 3 staff, equal 2 full-time positions. So there are, you know, Great Rivers has internal investigators and a lot larger staff. So that's pretty amazing. Slide 25. So they actually come out and do lobby visits, and they visited 2 of our counties, and agencies were well marked. They actually visited Florence County, which has had a lot of staff turnover, and so again, the findings were very good. So basically, just kind of kudos to our staff. I have an excellent department. They work together well. I think the review is really, you know, if you have the time to kind of look through it, it really says what we do. We take pride in the work that we do. So monthly update. So this is what I usually send out. Kind of gives us the numbers for Sawyer County specifically. And so I've got the updated one, and it's probably going to be pretty close. So total food share cases as of July, 1,168. Total food share recipients, 2,086. And then $497,000 were issued in benefits. So right now with the pandemic, I always make a note on there, because we have been receiving emergency allotments. So households are receiving the maximum for their assistance size right now. That's been very helpful with the price of food being what it is. Healthcare cases, we have 1,783 Badger Care cases, 587 EBD cases, and 218 long-term care cases. Long-term care cases include those in nursing homes and those receiving assistance to stay in their homes, trying to avoid a nursing home placement. So we operate a call center, 12 counties. So for July, we had a little over 7,000 calls. And our answer rate was 92%. Applications processed, we had 1,589 applications, 99% processed timely. Renewals, 1,762 renewals. And that's food share, because right now all healthcare renewals are postponed. So that's just food share, 99% of those processed timely. Food share 6-month reports, they have to do just a quick report form every 6 months to recertify. And those, we had 520 in July, 97%, and a 3-day average to process. So we get through them pretty quickly. Again, all renewals are being postponed for healthcare. We did get notice from the feds that the public health emergency is extended. So right now, keep doing this planning on the unwinding. The first chance of us looking at doing healthcare renewals would be, we get notice in January and start doing those in February. Of course, it can still be postponed again. So right now, healthcare cannot be, if you received it at any time during the pandemic period, say you were, you lost your job, and you applied for Badger Care, now you're working again. We can't end your health care. Because of the pandemic, people continue with their health care right now. The only way that it ends is if you pass away, move out of state, or you call us and say, I've got new insurance, I don't need it anymore. Otherwise, that's in place right now due to the pandemic. Any questions?
I have a question on the EDP cards. I think you mentioned that to qualify, you need like $2,100 or something monthly income. Is that-
Gross income.
So how often is that number assessed? Like, do they do that yearly and then they're like, the card is good for a full year, or how often is that have to be validated?
So you apply for the program. We do receive verifications, pay stubs or employer verification form from the employer and certify the benefits. If they have a change in their income, say they change jobs and are making more, they have 10 days to report that change.
So it's up to them to report if they have an increase. Otherwise, once somebody gets their card, do they have to then re-verify it every year or something like that? Or it's just continue, they maintain it as long as they don't report that they have.
So the food share 6-month report form, or what we call a SMRF, that they have to recertify again. So it'll go through and it's a form and they can have it completed over the phone if they choose to, if that's easier for them. But basically they are certifying that the information on that form is still correct. If they've had a change, they are supposed to indicate that change and then provide you pay
So every
stubs.
6 months, basically.
Every 6 months, and then we do receive state wage information alerts. So what that does is the information that we have in CARES Worker Web matches what employers are reporting to the state. If there's a discrepancy, that comes up on a report, and then we follow up on that. We can request historical earnings.
Okay. The other reason I asked on slide 26, it mentions a permanent EDP card. I'm like, what is permanent mean?
Yeah.
That's why
Yeah.
it's confusing me. But permanent to me sounds like this is your card for the rest of your life.
No, and like I said, the fraud part of things, we could talk fraud all day long. So that's my wheelhouse, right now, the only way we can do overpayments though is if it's intentional. So it is quite the process right now. You have to send out a waiver stating what the finding is. That person has to, willingly sign the waiver, and then they are sanctioned from receiving food stamps. It's a first time violation for 12 months. If they don't sign the waiver, we're going to a hearing.
Okay, thank you.
Any other questions or comments for Shauna?
Not a good report.
It is.
Anybody online?
It's been amazing here.
Nobody seems to have their hand up.
Thank you, Shauna.
All right.
That concludes the economic support. Next is the public health report submitted by Julia Lyons. I'll highlight a couple of things. On her first page, she has some summaries about updated CDC guidance for COVID-19. And I can tell you she's been receiving a lot of calls or what have you to asking for such guidance, especially internally. Internally, we've had a number of employees get COVID, and so she refers people to this, make it quick and easy.
And now I know what's just brought to us, so.
I'm
Let's-
sorry, your number what? What was your comment?
We're no longer. Okay, change.
Yes. Okay, yeah. Mhm.
She also indicated in report, the new bivalent booster is expected to be released in September, and I think it's been on the news for a little bit. Looks like Birth to Three had a collaborative experience with LCO, Birth to Three, or at least a grant collaborative, where they were able to go to take a number of families to Wilderness Walk, and I think she said, yeah, 60 attendees. Sounds like a pretty good turnout. And she notes emergency preparedness. I think I saw the sheriff talking about that at the last county board meeting. But I also like to note that I believe in November, we're going to try to have a preparedness exercise within Health and Human Services. So next month, we will bring a date and a time. We'd like to close the agency down to have an exercise. Are there any questions or comments regarding the report?
I have
There
a
is.
question. I don't know if it's for you or maybe for Ms. Lyons, but Lorraine mentioned there's a shortage of the flu shot vaccines at LCO. Is there a nationwide or a statewide shortage as well, or is that?
I think they just haven't received vaccine yet. And with case, we don't get a whole lot of vaccine internally here. We have enough partners in the community that are actually vaccinated. So we can get a little bit more.
So no shortage.
Not that I'm.
Okay, thank you.
Okay, if there aren't any questions or comments, that concludes the public health report.
Okay. Well, it's fiscal, is this Patty's?
Yep.
And Patty is online.
Yes, she is.
Patty, can you hear us?
I can hear you.
Please go along with your report.
Okay, basically it is just the report through July, showing where we are standing at this point in time. And our budget for the year so far is looking pretty good.
Any questions from Patty? Did you want to talk about the services recap separately?
Only if you've got questions on it. There's nothing to highlight that's standing out specifically.
I think that's. Let's see. That's the agenda now. Future calendar items.
Yes, next month, Julia Lyons will give an overview of the public health unit.
Okay. Okay, we're adjourned.